Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group MIGRAINENATION, and chronic daily migraine survivor. I'm here each week with Dr. Vincent Martin, MD. He is the president of the National Headache Foundation and the director of the Headache and Facial Pain Center at the University of Cincinnati. We are here each week to bring you tidbits and useful information on headaches and migraines. This week, we are going to talk about speech troubles with your migraines. There are some very interesting things to learn having to do with the way we speak when we have migraines and what our auras can do with the way we communicate. I had this idea for this podcast because I was going to bring on this awesome woman to interview, and she said she didn't want to come on because she had an aura that affected the way she spoke. And I told her, I said, I have the same problem, and you just apologize and you repeat what it was you were going to say. So we decided we would talk about this today. So my first question is, what kind of speech problems do migraine patients get?
Well, migraine patients get a number of different speech problems.
Yes.
There are a couple that are more, are probably more prominent.
Mm-hmm.
There's one called aphasia.
Mm-hmm.
And aphasia takes two different forms.
Mm-hmm.
It either could be a lack of recognition of what's spoken to them. So they basically don't understand what someone else is saying.
Right.
But the other kind of aphasia is basically where the brain doesn't put together all the sentence structure and you get this jarbled bunch of mixed up words and so forth. And that's actually called expressive aphasia. And when you can't understand what somebody's saying, it's called receptive aphasia as well.
Right.
And then there's another term in medical terms called dysarthria.
Right.
And that's basically where you just jarble your words. It's basically a disorder that involves the nerves that go to all the muscles that control your speech. And
Right.
you'll be slurring your speech. And each one of these different types of auras kind of implies a different area of the brain being involved by the aura. But in addition to those are probably more ominous types of speech processes and ones that are more evident. There's
Right.
a lot.
I was going to say, sorry, the dysphagia and dysarthria and aphasia are the two biggest kinds that we think of, but there are more.
Yeah, there are actually ones that they're even more common. Like oftentimes patients with migraine can not remember words, for example, which is really probably more of a memory issue.
Mm-hmm.
But I think many people would perceive that as a speech problem as well. In addition, migraine patients can stutter. They may flip words, so they may not be able to, they may flip a word for another. And then there's one really interesting syndrome called foreign language syndrome, where patients actually flip into a different accent.
Right.
So they'll be talking to you, and all of a sudden they'll be talking with an English accent, and all of a sudden they'll flip into a French accent.
Yeah.
And even though we don't know for sure what causes that,
Mm-hmm.
we do know that patients with migraine are more likely to have that happen to them.
Right.
So it's possible that could be somehow related as well. So it's a speech problems in a minor form can occur fairly commonly. The real dramatic ones, like we saw in that one TV reporter that had the speech abnormalities. Maybe you can even talk about that.
Right.
Well, but that fortunately that's fairly uncommon.
Right. So what Dr. Martin is talking about is Serene Branson. She was reporting on the Grammys, and many of us have seen this video. And this is another interesting example of what can happen. She had a migraine, and while she was reporting, she started to, the best word is probably babble. Her words really didn't make sense.
CBS 2's Serene Branson is live at the Staples Center with highlights and backstage coverage we're seeing for the very first time. Serene.
Well, a very, very heavy debatation tonight. We had a very Darrison by, let's go to Terrace Chase and look for the bit, the head of the pit.
And I think that work, when I talk to people, is one of the places that we are most affected by these speech problems. And when people talk about migraine in work, other than just the sheer disability of the pain, etc., I think speech problems is one of the biggest thing that affects our work ability. And so that was one of the other reasons we wanted to discuss this. I wanted to interject here that some of these speech problems, and I think, Dr. Martin, why don't you interject which ones? Some of these speech problems, you know, if you get them for the first time, you may want to be evaluated. Some of them are very common and you are fine, but which ones, if they get them, should they go ahead and be evaluated if it's the first time and it's not a common part of their migraine disease?
I would say if you have what we described before as either the aphasia or the dysarthria, that if that happens for the first time, then that should probably be evaluated, because there can be some times, you know, where that represents like stroke or other brain disorders. However, if it's a recurrent pattern, you know, even those speech processes that you might be concerned about most likely represent just another type of aura.
Okay. Now, it's interesting to note that there are certain medications a lot of us take, like topiramate, that will cause this word searching problem where we can't think of words. It will cause it a lot. And so that is very common on some of our migraine medications. And so we shouldn't be concerned if that pops up a lot. So my next question is, what causes these speech abnormalities? What's going on in our brains during this migraine that's causing these problems?
Well, in most cases, they're going to represent a type of aura. So an aura is basically this electrical wave that kind of travels along the surface of the brain and kind of disrupts nerve cells temporarily. And this disruption can cause language problems. Mm-hmm. And depending on what the symptom is or what the type of language problem may be, mm-hmm. it will influence where the aura is located. So for example, aphasia often happens in the cortex, and dysarthria, which is the slurred, garbled speech, often happens in the brainstem, and that's called a brainstem aura, or what they call basilar type migraine is an old term, or basilar migraine. You might hear all those different terms, but usually when that dysarthria occurs, that garbled speech, usually patients have other symptoms like double vision or vertigo or tinnitus, which is ringing of the ear, or even some hearing loss. There are other signs that the brainstem, which is in the base of the head, that there's an aura that involves that area of the brain. So it occurs in people with aura. A speech aura is fairly common, occurs in about 20% of people that have migraine with aura, at least in some studies as well. So it also can occur in conjunction with other aura symptoms. Mm-hmm. So for example, you could have a sensory aura, which is where you get numbness or tingling of a arm, leg, or even the face, mm-hmm. Along with the speech aura, and they can occur together. In fact, one study suggested that if you had a sensory aura, that numbness or tingling of the face, mm-hmm. and when it reached the face, that was when they were more likely to have the speech aura.
Right. Okay. You have definitely touched on my next question, but I'm going to ask it anyway in case you want to add more. I wanted to ask if speech symptoms usually occur by themselves, or with other symptoms. Is there anything more you wanted to add to that?
Well, I would add to that they can occur either in isolation by themselves, or they can occur along with other symptoms. And probably people who are more likely to have sensory and motor auras are probably more likely to have speech abnormalities as well. Okay. Now, the minor problems with speech, like the word finding problems and flipping words and so forth, could really happen with either migraine with aura or migraine without aura. So that may not necessarily be specific only to those with aura. So it really depends on what type of speech abnormality that you might be talking about.
Okay. How common, you also touched on this, but I would like to touch on how common speech symptoms are in migraine. Can most of us expect to experience them at some point? I know I have had them for a long time. And I have them on the podcasts. I've had them when I've given talks. I've had them in meetings. So how many of us can expect to experience them?
I don't have an exact number for the minor abnormalities, but I would say this: I've taken care of tens of thousands of migraine patients, mm-hmm. and it's a fairly common complaint. it's kind of embarrassing because people think, particularly when they can't remember words in particular, that they're having like some form of Alzheimer's or something, that they things they do. And also it can be embarrassing in a work situation where you can't retrieve words,
Yes.
so forth. That can be a real problem as well. In fact,
Yes.
I've had that happen to myself when I was giving a talk and I can't retrieve something, or I'll be seeing somebody in the hallway and I can't remember who they are when I have a migraine. It's just like, and then all of a sudden when the migraine's over, it kind of goes away. And really that's probably more of a problem with memory than specific speech. But I think people would associate that with speech as well.
Yes. I think the worst one I ever had, just so people in case people can relate, is I was in a neurology meeting when I used to work in a neurology laboratory, and I had many moments of a complete tongue tie where I couldn't get any words out at all. And that is the only time that ever happened to me. It was like there were no words, and I've never had that happen. Usually I just can't find the right word. So that was very interesting for me. So yes, it is embarrassing, especially when you're expected to say something intelligent and nothing's coming out at all. So how do we treat these speech symptoms in migraine?
Well, what I would say is that we treat it much like we would any other patient that has an aura.
Mm-hmm.
So at least in my experience, there are certain medications that work better with aura than in patients that do not have aura.
Mm-hmm.
And one of the big ones would be a medication called verapamil, which is a blood pressure medication.
Mm-hmm.
So that's a common one I would use in this situation. Sometimes you can give an aspirin a day to patients with auras, and that seems to help. And then there are a variety of seizure meds, which could work both with people that are both with and without aura.
Mm-hmm.
But I use them in people that have complex auras. It would be medications like topiramate, although once again you have to worry about the word finding problems in this situation,
Right.
or another medication called Depakote, which they're both seizure meds that are both FDA approved for the treatment of migraine. So I try to choose meds that, at least in my experience, seem to work better for aura than other meds.
Okay. All right. Is there anything else you would like to add on our topic of speech troubles with migraine?
Don't beat yourself up. No, seriously. I mean, I'm
so true.
I'm the type of person where, I always I'm hard on myself. And, if I had a migraine, I was giving a talk and it didn't go well, I would be upset with myself.
Yes.
But the reality is it's just part of a migraine.
Yep.
And you just need to learn how to manage the migraines the best you can and not get too concerned or disturbed by some of these speech abnormalities or disturbances.
Yes, just apologize and keep going and learn tricks to get around it.
Exactly.
So this is Dr. Martin and Dr. Weitzel signing off until next week on Heads Up, the weekly podcast of the National Headache Foundation.